Hi, I'm Henry Bonsu and you're listening to The Threshold, a new series from Foreign Policy about how to end the deadliest infectious diseases around the world. More than 2 million people die every year from 3 infectious diseases: HIV/AIDS, malaria and tuberculosis. TB alone claimed more than 1.25 million lives in 2023, overtaking COVID as the world's deadliest infectious disease. On the surface, the fight to end these diseases is harder now than it's ever been. Aid for global health dropped more than 20% this year. But for the first time in decades, science is giving us a real chance to end these diseases. Could we eliminate HIV, TB and malaria within our lifetimes? And what will it take to get there, particularly in the current climate?
This is 47th 50th Street, Rockefeller Center.
I'm headed to Rockefeller Plaza in New York during the recent United Nations General Assembly Week, or UNGA as we call it. I'm moderating a panel at Foreign Policy's Health Forum with 2 people uniquely qualified to answer these big questions about the future of disease elimination. I'm excited to talk to Mark Suzman, Chief Executive of the Gates Foundation, the largest philanthropic funder of global health in the world, and Rosemary Mburu, Executive Director of WACI Health, a leading advocacy organisation championing the end of life-threatening epidemics in Africa. They throw around a few terms I'm going to define here for folks not following this space closely. ARVs are antiretrovirals. These drugs treat HIV. And The Goalkeepers is an annual Gates event that took place a few days before this recording. It's also worth noting that the Gates Foundation supports this podcast. We began our conversation with the innovations they believe are the most promising to end these diseases, including lenacapavir, a new HIV prevention drug. The morning of our taping, the Gates Foundation announced a partnership to expand access to generic versions of lenacapavir, making it available for $40 a year starting in 2027. So I wanted to ask Mark about this and why this is so significant.
Yes, well, the excitement we have about this drug, lenacapavir, is it's something that is essentially 99.9% effective at preventing HIV. And it's a 6-monthly injectable developed by a company called Gilead. And our announcement, which we've made in parallel with an announcement that's been made by some other partners, including the Clinton Chai Initiative, the UNITAID, is to be able to develop that drug with partners in generic manufacturers in India that is going to make it available at $40. Currently, it's available in high-income countries like the US for many thousands of dollars. And so what this is showing what's actually possible, the kind of pipeline of innovation we have in global health, transforming a disease like HIV/AIDS. And so we've made that announcement on the heels of an announcement we made earlier this week as well, which was our commitment to the Global Fund to fight AIDS, TB, and malaria, where we've committed $912 million to their current replenishment, because partnerships like that are key to actually make sure that tools like the new lenacapavir generic are going to be made available and affordable for people who most need them. So we want to show progress is not just possible, it's happening. Progress against these diseases is real, but it needs much more energy and commitment.
Brief supplementary. How much of a game changer could this be?
It's a huge game changer because of the cost effectiveness and the actual clinical effectiveness, the fact that it is nearly 100% effective. And so it's not going to be transformative initially, but when you add it to a full program of HIV and you're combining prevention and treatment, and ultimately we haven't given up all the R&D on a cure, which we still are optimistic we will get, that is a pathway to something we hope by the end of the Gates Foundation's lifetime, and we've announced earlier this year that we will be closing our doors in 2045 because we are making a historic commitment to spend $200 billion between now and then with a vision of ending the scourge of infectious diseases like HIV, TB, malaria, and polio by that deadline. And a tool like this is an essential one to get on that pathway to disease control.
Thank you, Mark. Rosemary, I'm wondering whether you're just as excited about this development from where you're sitting in Nairobi and travelling across Africa and putting pressure on the likes of the World Bank, the IMF and other organisations as an advocate. Does it seem just as powerful to you, or do you have other concerns?
It's absolutely powerful, and it's amazing. I sit here and I reflect back on the journey we have come, and the fact that we can have intervention like lenacapavir and have it be rolled out simultaneously in high-income countries as it's been rolled out in LMICs, it's amazing. I think this deal, and thank you to the foundation and all the partners that have come together on this deal, I think places LEN as perhaps the first tool, the first intervention where we're gonna see equity in terms of rollout in both high-income countries and LMICs. And I say this because
when you say LMICs, you talk about
in low and middle-income countries. So basically, I'm from Kenya and other countries where we have always been the last on the queue to actually access scientific discoveries. So deals and progress that can actually ensure that we put that, people in LMICs and high-income countries and roll out products at the same time is very important. And I also say this because we are at a very critical time. I just look back to where we've come from. I mean, growing up in Kenya and coming of age in the late 80s into the early 90s, where HIV epidemic was ravaging communities, where also science was just emerging, but also where, in many countries like Kenya, we were going through structural adjustment programs, which made it difficult for our government to spend on health. And then later on, towards the late 90s, a country like Kenya in 1996 started accessing ARVs, but it was only for the rich. I mean, people couldn't afford that. And so having a product that works and people could not access, I think we have many lessons learned. And to where we are now with the kind of global solidarity that we are seeing, the way science has grown, and then putting equity at the center of that is exciting.
Mm-hmm. We're talking about lenacapavir, but there are other scientific developments which you may be aware of that you're very keen on and that you want to see get down to the last mile, to the people that you're talking about. Which other areas are you very keen to see more development in?
I think in terms of ending infectious diseases, and in particular HIV, TB, and malaria, we have seen progress. We have seen in malaria, we have 2 vaccines, but also we are looking at seasonal interventions which are working. We also look at TB. The field has come a long way. We are talking about more affordable diagnostics. We are looking at shorter drug-resistant TB treatments. We are looking at, even within HIV, an arsenal, a toolbox of other interventions, with LEN really being the most exciting at the moment because of everything that has happened. But for TB, for HIV, for malaria, there has been movement in the right direction when we come to scientific discoveries.
Tremendous. Thank you, Rosemary. Mark, what does this tell us about the potential for a future in which infectious diseases like HIV, malaria or TB can genuinely be eliminated? Because we keep hearing about AI and all the potential. Bill Gates was talking about this at the Goalkeepers event. Can it really happen?
The short answer is yes, it absolutely can happen. And we're determined to help make sure that it does happen. And that is the core goal. When we announced our 2045 target, it has 2 core goals that it's out. The first is that no mother or child should die of a preventable cause, and nobody should die of an infectious disease, like the big scourge of the infectious disease of HIV, TB, and malaria, the 3 big killers, and malaria especially a killer of children. And both of those goals are broadly possible, and we've already seen tremendous success. It's often not understood how huge the progress has been between 2000, which was when the Gates Foundation was founded, and today. We've seen a halving of deaths in HIV, in TB, and malaria. But that still means there are way too many deaths. We still have 1.6 million people dying of TB every year. It's the infectious disease that kills more people than any other. We have 600,000, the vast majority of them dying of malaria. We still have 1.4 million new HIV cases every year, which is where tools like lenacapavir begin to be so critical. But with the pipeline of innovation we have, and you've just heard some of those tools from Rosemary, we're in the process of investing many hundreds of millions of dollars in what would be the first new tuberculosis vaccine in over a century, which is currently under trials in Africa and Asia, and we will know by 2027 whether that vaccine works. And if it does, it could be transformative against this disease that has plagued humanity for tens of thousands of years. And similarly in HIV, we are trying to combine all of those tools, the prevention for those who don't have HIV to stop them getting the disease, the treatment for those who do have HIV so they can live healthy, disease-free lives, and ultimately the cure, and we hope a vaccine that will stop anyone worrying about HIV in the future. And so across all of those diseases, we hope that by 2045 and for the generations that come after, these will be things for the history books, that people will tell their stories about the diseases that used to exist, like malaria, like tuberculosis, and that is our goal and our commitment.
Thank you. Rosemary, Mark talks about these diseases as being something that children in 2045 will read in the history books. How realistic does that vivid and optimistic scenario seem to you?
Yeah, so an optimistic scenario is, I imagine a world where we scaled up these tools, we scaled up this innovation, and that will take being intentional in terms of delivery and in terms of financing. And one of the things that has inspired me during this week is like the goalkeeper's theme, don't stop at almost.
Yeah.
And we are so close in some ways, but also conscious that the diseases are not at the same level in terms of making progress towards, ending as a public health threat. And also acknowledging that countries are not at the same level. But if you look at the Global Fund results report that's just launched a few weeks ago, we are looking at some countries. If you look at Kenya and TB, if you look at some countries like Cambodia and HIV, you can see that some countries are actually almost, when you think about 2030 targets, and some countries actually are ahead of the global target pathways. But for those countries to actually push to the last mile, we need more now than ever unprecedented global solidarity, more now than ever investments in financing, but also thinking about delivery, multi-drug dispensing, innovations like LEN, and how then we translate the science into public health impact. But we have come so close, but also we need to think about some countries that are struggling. The story of malaria is one where you have countries that have actually eliminated and made progress, but you also have countries where they are springing upwards. So just thinking about the differentiated approaches, but yes, I think I'm optimistic about that.
Throughout this season, you'll hear much more about these scientific developments, including lenacapavir, a TB vaccine candidate, and innovative ways to eliminate malaria. But in the next part of this episode, they get into the main question on our minds. How will we fund all this science, especially as donor countries are shifting away from global health? More on that after the break. This next part of my conversation with Mark Suzman, Chief Executive of the Gates Foundation, and Rosemary Mburu, Executive Director of WACI Health, centres on the hardest part of disease elimination right now. Where will the money come from? Well, there's an international effort happening right now all about this. The Global Fund to fight AIDS, tuberculosis and malaria supports efforts around the world to defeat these three diseases. Launched in 2002, then UN Secretary-General Kofi Annan pushed for the creation of a global health fund for combating infectious diseases. The Global Fund is a partnership between governments, civil society, the private sector and communities, with more than 90% of its financing coming from donor countries. By pooling resources, they are able to deliver innovations at scale in more than 120 countries. The Global Fund raises money in 3-year cycles, what they call replenishment. Right now, they're asking countries to pledge funding toward their 8th replenishment, which ends in November. The US has historically been its largest donor. So I wanted to start this next part of the conversation with their thoughts about the Global Fund and their concerns.
And Rosemary, you mentioned the replenishment a moment ago, and the clock is ticking rather loudly down to the all-important event happening on the margins of the G20 in Johannesburg. The Global Fund to fight AIDS, TB and malaria is going to be asking the world to come together again.
Yeah.
How concerned are you that people aren't listening today as they used to before? And what is your tactic as an advocate to make sure they do?
Yeah, I think we, as an advocate, we have a story to tell of the progress we have made. The scientific discoveries that we've made also actually mean that in our narrative, we have come a long way, and we really need to double down on investments, which mean that for now, the Global Fund is perhaps one of the best global health investments. And since we are talking about the replenishment, what the 18 billion US dollars, which is the target for the replenishment, is giving us actually is a lifeline, for communities. I see the 18 billion US dollars not just as a target, but actually as a lifeline for communities, people whose lives will change because of the new innovations, because of the investments, because of how we invest in the delivery, but also because the potential that this investment has in terms of saving an additional, up to 23 million lives, averting about 400 million infections across the diseases, reducing mortality, combined mortality across the 3 diseases by about 64%, is really a story of the future that we want, where we are so close to that. But also the fact that this replenishment is being co-hosted by the governments of South Africa and the UK is also a story about Africa's leadership. And that is something that I think the world needs to come together to support. So even though we haven't seen this amount of, dramatic shifts and politicization in global health, I think the Global Fund replenishment and us being successful in that is a great entry point to actually turn things around and to help scale up the innovations we are talking about. And by the way, Mike, thank you and congratulations to the foundation for pledging to the Global Fund.
Yes. In radio terms, we would call that a segue, because I was coming to exactly that point. 912 million US dollars. US! Bill Gates announced that at the Goalkeepers event on Monday night. I was privileged to be there in the room, as you were, Mark. How crucial is this investment in the current context? And why has the foundation kept the faith with the Global Fund?
So we've kept the faith because, I'll remove the perhaps from Rosemary's comment, as the Global Fund is the most successful life-saving initiative of the 21st century by far. It has saved over 70 million lives to date over its 23 years of life. That's an extraordinary achievement, and it's done so in an unprecedented way. It's crowded in philanthropic resources, private resources, governmental resources, pooled them together, driven down the costs of bed nets to prevent malaria, of antiretrovirals for HIV, of treatments for tuberculosis, and it keeps doing that. And that success story, I actually worry the world has become almost a bit jaded and used to, and doesn't really internalize how profound that is. 70 million is almost too big a number. It's abstract. And trying to bring it down to the very human level, that is, 70 million people who are not dying. That's extraordinary. And that is a frustration for those of us who work in this space, that there is a pulling back. I think we're very concerned that on current trend lines, the Global Fund replenishment target risks not being met. That we've seen multiple countries across Europe, debate going on here in the United States about what their role should be. People are saying we need to focus on domestic issues. There are other challenges, there are fiscal pressures. And our argument, which we're putting our money where our mouth is with that $912 million commitment, is these are very modest proportional commitments relative to total budgets, and you will get almost no investment that has a higher human impact. And that it's critical that, especially now with this pipeline of innovation we're talking about, that we double down, because if we don't crowd in these resources, if we don't build on these partnerships, and those are partnerships that are getting increasing co-financing from countries in Africa and Asia on the ground who know that the long-term pathway is to be self-reliant for those treatments, then we won't meet those targets that we're setting for 2045. The Gates Foundation's resources are significant. They are a fraction of what are needed to meet those goals. And so we're doing this as a very urgent call to action that by this November event, we hope and are cautiously optimistic that we will see the world respond again and make a very generous set of commitments.
Indeed, you describe it very well, very pertinently. The headwinds are very, very strong. They're all coming at us very, very powerfully. You talked about co-financing. I went to the World Health Assembly in May in Geneva, and then I just come back from Lusaka for the World Health Organization Africa meeting. Rosemary, I'm not sure if you were there, but if you were, you would hear the term DRM, Domestic Resource Mobilization.
Yeah.
And there are lots of countries, including the Nigerians, I think the Ivoirians, Cote d'Ivoire, the Zimbabweans, who have said, we read the writing on the wall, we were warned about this, we've been trying to step up. What are you seeing?
Yeah, so African countries definitely determined to work towards stronger domestic leadership. There are plans and frameworks that the African Union members have been working towards. Of course, there are a number of challenges when you think about the fiscal space, when you think about the GDP and debt ratio and how that constrains government's ability to invest. But from an advocacy point of view, our biggest message has been to say that, yes, we need to continue to push, we need to continue to figure out health financing reforms that can actually unlock resources, the public resources, but also tap into partnerships, like unlock private sector money. But also the conversation around domestic resource mobilization, I think it's important to put it in context to say that while African governments are moving towards that direction and are talking about sovereignty, self-reliance and all that, it's important to couple that with global health solidarity, because even as we look at countries that are transitioning, transition is a process, is a pathway, and it has to be methodical and over time. And so I think partners that can come along with national governments along that pathway of transition and really understand what milestones and what are the markers of transition and journey with countries in respectful relationships, equal relationships, I think that will help, because we are saying that, yes, we can work towards that leadership, but there can never be sovereignty without solidarity. So it's really important to talk about how partners can support national governments in making progress towards that pathway.
I'm going to butt in and explain what Rosemary is talking about here with sovereignty. In August, the President of Ghana, John Dramani Mahama, convened the first ever Africa Health Sovereignty Summit in Accra. African leaders and global health partners met to redefine Africa's role in its own health future, including shifting from external donors towards self-reliance. Now, this is not the first time this has happened. There was the Abuja Declaration nearly 25 years ago, which called for African governments to allocate at least 15% of their national budgets to improve healthcare. Few have done so. But this summit has created a lot of enthusiasm, so I wanted Rosemary's take on this.
It should be different. It should be different. I mean, the thing is that the kind of shift and politicization we've seen in global health right now, one thing is for sure is that the global health ecosystem was due for a conversation around how we reimagine and how we rethink global health architecture. And so I would like to think that we are at a point where we really need to think about that. We really need to think about how can we make the global health architecture better and work even for low and middle income countries? What are the challenges with the way the current architecture is shaped up, and how does it, in the way it's structured, limit that kind of progress? And so I think it's a good conversation and dialogue to have. What I celebrate is really the leadership to say, look, as Africa, we need to figure this out. We need to do something. But I think the point is that we cannot do it alone. I think it's not either all, domestic sovereignty and all that. I think it really speaks to the need for the global solidarity and even thinking about global health from a global security point of view.
And on that point of global solidarity, Mark, I mean, global health used to be a bipartisan issue here in this country and in many of the high-income countries around the world. Not so much these days. What do you think it's going to take in order to get us back to where we were, a consensus that this affects every country in the world and it shouldn't be a partisan issue?
Yes. Well, first I want to emphasize that I think and truly believe that global health is not a partisan or even bipartisan issue. It is a non-partisan issue. It is an issue, it's a set of values that we all share, that are embedded in the Sustainable Development Goals, that was a commitment by every country in the world to their own citizens about a vision of a healthy and productive future for all their citizens. And I think even in the US, we still have strong support from both Republicans and Democrats in Congress for these global health priorities. We are engaging very actively with the US administration about what can be done and the importance of continued US global health leadership. And it is important to stress the US has been by far the largest contributor to global health funding over the last 25 years and to both the institutions like the Global Fund and more broadly in sectors like HIV. And so we are absolutely continuing to make that case. And while there are active debates, I think a lot of the proof will be in what happens at coming moments like the Global Fund replenishment. Do countries really step up? Do they put their money at where there are the most impactful interventions? And we will be using our voice, and we're cautiously optimistic that we will be able to do that. And just to match it, it does need to be matched by commitments by the low and middle income countries themselves. African countries have, for decades, made commitments that are embedded in the African Union about the percentage of their budgets they should be spending on global health, and the vast majority of African countries have not actually met those targets. And I think this is a moment where there is now very genuine debate and discussion at the heads of state level, at the finance ministry level, at institutions like the World Bank about what is that pathway, as Rosemary, to self-reliance, but it's a pathway that has to be over many years, with matched by some of the global health support that institutions like ours and we hope high-income governments do continue to provide.
Okay, we've got just 45 seconds left. I'm going to pivot to you, Rosemary. Can you spend the next few seconds giving us grounds for optimism? What makes you feel optimistic about the future? You've been working so hard for so many years in this space.
Yeah, and what gives me optimism is that going back 30 years back and where we are now, this journey has been characterized by global solidarity, what we are talking about, with the rise of institutions like the Global Fund, partnerships like PEPFAR, the philanthropy sector coming on board and having science rise and rise. And so I think just looking at how far we have come and the fact that we are close, we have the tools. If we could get the tools, scale them, and ensure that we can roll them out in low and middle income countries and make sure that to the last village, these tools reach and actually transform lives. So translating science into equitable public health impact. I'm optimistic about that if we can double down on the finances and we can think about strategic delivery models.
Rosemary Mburu, Executive Director of WACI Health, and Mark Suzman, Chief Executive of the Gates Foundation. Thank you very much indeed for being my guests on this first edition of The Threshold.
Thank you.
The Threshold is a production of Foreign Policy, made possible through funding in part from the Gates Foundation. This podcast is hosted by me, Henry Bonsu. It's produced by Laura Rosborough-Tellem, who also helped create the show. Rob Sachs is our editor, and Indra Dalasakhan provided production assistance. Next time on The Threshold, how the Minister of Health in Indonesia has successfully cracked the code of health financing.
I realized many institutions is eager to give us money. They just need a credible plan.
And more about the Africa Health Sovereignty Summit and how African countries are leading the path forward away from outdated development models.
It was the first time to see a president, like at the presidential level, really bring all the different players to the same place.
All that next week.